Jackson. I'm an osteopath at Glastonbury Surgery and I work for the Somerset Health Practice. I'd like to show you the elbow and we'll talk about a few problems that the elbow can have. So the elbow is in the middle here of the arm. The top bone is called the humerus and the bottom two bones, which we twist to rotate when the hand moves, is the radius and the ulna. So if we break these bones, we say, what have you broken? Have you broken the radius or the ulna? So we may know it from those. So the most common problem of the elbow is probably something we've all heard about, is tennis elbow and golfer's elbow. So tennis elbow is this side, the extensor compartment of these tendons and muscles. And the golfer's elbow is on the other side. So this is the flexor compartment. So both of these muscles attach via tendons to the epicondyles. The epicondyles here of the humerus. There we are. So this is our tennis elbow. And this is our golfer's elbow. So golfer's elbow, both of them are irritated by gripping. So as we can see, as we grip, we stretch all of these muscles. As we twist, we stretch all of these muscles. So that's what irritates these tennis elbow. So again, tennis shot will be twisting and rotating, but also the force which travels from the tennis racket comes down to here to hit onto the tendons which attach onto the epicondyle. So it's not just tennis, but any sort of twisting motion or repetitive strain will initiate this. The golfer's elbow is when we clasp and grip too much. And again, with the golfing shot, then this gets a lot of stress or friction through onto this. But again, it's not just golfer's elbow that we get it. So we've talked about the two tendon problems. We also have ligaments either side. So on the outside, we call it the lateral and the medial side. And we'll test this as an osteopath, just sort of how they feel. So what sort of things could cause a problem for a ligament? And that'd be excessive jarring or force that's put through either one side or the other. And that will damage the ligament. And inside the capsule, we can also have a problem. So if we strain the capsule, again, with an impact or sudden sort of sharp movement to it, then that will cause an inflammation and fluid will come about due to that inflammation. And then that will make the capsule swell, make it more uncomfortable, and take several days or weeks to settle. And again, we won't, when there's fluid in the capsule, we won't be able to extend or flex fully. So that can be a problem. So arthritis can also affect the elbow. Overuse can cause sort of little bony growths or irregular contours to this natural smooth contour of the bone, and that will impinge it. So when we move it, and maybe we might have a sort of elbow that can only move to a certain degree or can't quite move it in. So that could be an arthritic pattern. So an X-ray is recommended there for that. The radial head, so the radius, yeah. So this moves, you might be able to see that it twists and turns as we move our wrist and articulates here on the humerus. So that sometimes can get jammed up. Now an osteopath might free that up a little bit in conjunction with a pattern of tennis elbow here. So a lot of these structures are soft tissue. So soft tissue means that we can ultrasound them and we can see what problems are with that. So with a tennis elbow, we may be able to grade what type of inflammation is associated, if there's any tendon tears, or if it's pulled away, it's been quite severe, it's pulled away at the bone and created a little spurring from that. Ligaments, we can scan ligaments and we can see if they are damaged, torn, and again we can just check for fluid. Now, talking about fluid, the other thing that I was going to mention is a bursa. So a bursa here are olecranon bursitis, or student's elbow it's called. So when typically students are studying for long hours on a desk, then it irritates down here, and we can have a swelling on the elbow. Now sometimes this fluid is drawn off, aspirated we call by a doctor. Sometimes they inject it with a steroid too. So these are a few issues that affect the elbow. If there's any questions or comments, please feel free to contact. I hope it's helped. Thank you.